The speakers in this second session are John Devaney, talking about children living with domestic violence, then people from Sistah Space, and Anna Mitchell from Safe and Together. Again, we're going to be looking very much at practice, achievements and opportunities here. But first of all, John Devaney, to look at the position of children's well-being when they're living with domestic violence. So over to you, John.
Thanks very much for the invitation to join you all today. In terms of my presentation, I've shifted the focus slightly to think about children in the context of their relationships with their mothers, and I think it flows on very helpfully from the presentations this morning, particularly when we're talking about the issue of poverty. The research is being undertaken currently with colleagues Valeria Scafida from the University of Edinburgh and Fiona Morrison from the University of Stirling. And we're very grateful to the Nuffield Foundation, who have not only funded the study, but have also been really helpful in trying to help us think through what are the key messages that we'd like to sort of convey to others who are in a position where they can both inform wider policy and strategy, but also think about what are the practical implications of what the research is telling us. So the Nuffield Foundation have been a fantastic funder to be working with. If you would like to sort of read more about it, it's available in a journal article that was published at the start of this year in the Journal of Interpersonal Violence. It's free to access, so there's no financial barrier to being able to access it. Just go to the journal website and look for Valeria's name, and you should find the article there. I'm going to go through what I think are some of the key messages and findings from the current stage of the research, and we're only at the sort of the very beginning of it all, but I think there's some very important findings that are relevant to some of the broad themes for today. Now, many of you are here in participating in this event today because you have a real deep-seated passion for trying to make sure that children and adults who are victims of domestic violence and abuse, that we better understand what their needs are and how we might respond to those. We know that children are born into unequal circumstances, but we should all have that passion and drive to make sure that children have the maximum opportunity to realise their life chances. And as has been mentioned by others this morning, in particular sort of Manda's very impressive presentation, it's the impact on children's futures as well as their current well-being that we need to be thinking about, and how we try and pool services around a family in ways which are likely to be helpful rather than adding another layer of burden and demand on parents who are often struggling with a range of issues, of which domestic abuse is often only one dynamic. We know from the best data that we have that over a quarter of adult women in the UK experience some form of domestic abuse in their lifetime. And given the events of the past fortnight, if we add domestic abuse alongside the wider forms of gender-based violence that many women and children experience, then this is a significant social issue. The best statistics that we have, as flagged up by Nicole earlier on, come from an NSPCC study on child maltreatment undertaken a decade ago that was highlighting about 1 in 5 children grew up in families where they have experience of some form of domestic abuse and violence, and that while children's experiences of domestic abuse and violence have become much more prevalent and prominent in current policy and legal reform across the UK, one of the things that's still very apparent is that in a lot of the official discourse, we still talk about adult victims and their children. And so in a way, there's a separation out of children's experiences from those of their adults, which in one sense is very good to see children as being individuals in their own right, but somehow don't conceptualize them as being victimized as much as the adult victim in this particular context. And what we're hoping to do with the research is start to sort of unpick and unpack some of this through looking at sort of children living with domestic violence and trying to firstly provide a much more robust descriptive account of the extent and type of exposure to domestic violence experienced by different groups of mothers and their young children within Scotland. And following from that is trying to understand if children's exposure to domestic abuse has some causal detrimental impacts on their current and subsequent well-being and on their behaviour towards others. So trying to get a sense of not only what do children experience and what are the characteristics of the families in which they're living, but also trying to see sort of what is the impact on children's well-being going forward. Now, the way that we're going to do this is that we've been very fortunate that in Scotland we have a longitudinal survey called Growing Up in Scotland, and it's got a nationally representative sample of children and families from right across Scotland. In terms of our particular interests to do with domestic abuse, of the various longitudinal data sets in the UK, the Growing Up in Scotland one is probably the best data set for being able to do some work looking at the intersection of domestic violence and abuse with a whole other range of issues that are happening to children during their early and later years, because it actually has a much broader set of questions which have been embedded within this survey compared to, for example, the Millennium Cohort study, which has asked only one question of parents and in particular mothers about whether they've been hit by their partner, or the ALPSAC study, which is very good, but is really only based on one part of England. Now, Growing Up in Scotland started in 2004, and the first sweep of the study consisted of 5,217 babies born between June 2004 and May 2005, and the babies were 10 months old at the time of the first sweep, and there's been a sweep usually every year since then, gathering further data on these same children and their families as those children have grown up. And these children are now in their mid-teens. Interviews were carried out in participants' homes by researchers, and usually the informant is the child's mother, and occasionally if the child's partner or if the mother's partner is there, they're involved in answering questions as well. We have looked in the first tranche of our work at the 6th survey sweep, which at that stage had 3,646 mothers who were able to talk about the experiences that they'd had and their children had had over those first 6 years of the child's life. And so therefore the data that we're presenting here is really on the experiences of mothers with a younger child. On this slide, what you can see is the plethora of information that the survey gathers around children and their parents and families' situations. So there's a wealth of data there which helps us to try and place the experiences of children and mothers around domestic abuse within a wider set of understandings about who the families are who are experiencing these issues and what are the types of impacts that both adults and children in those families experience. The questions that were asked in the survey are in the red box to the left of this table, and the questions were lifted from the Scottish Crime Survey, which has asked very, very similar questions to the crime survey in England and Wales. Now, what we've done in terms of the analysis is to collapse some of these questions into their variables on the right-hand side of the screen, where we're trying to group some of the questions into what we think are expressions of coercive control, of physical violence and of threats, as a way of allowing us to do some of the analysis, not because we're not interested in the responses to the individual questions, but in terms of just having sufficient numbers to be able to do some of the statistical analysis that I'll come on to describe in a moment. But what you can get a sense of there is that the questions that are asked in Growing Up in Scotland try and cover a range of forms of behaviours that many of us would recognise as being indicative of domestic violence and abuse in a broad sense within the context of an intimate partner relationship. These are some of the initial findings whereby, in terms of the respondents in Growing Up in Scotland, 86% of mothers reported that they hadn't experienced any of those types of violence that I've shown on the previous slide, but we have nearly 14% of respondents who are saying that they have experienced one or more of those different forms of harm. If you look at the bottom of the screen, that 14% contrasts quite starkly with the previous statistics that we had in Scotland, whereby from the Scottish Crime and Justice Survey, only 3.4% of women were reporting that they'd experienced any partner abuse in the past 12 months. Now, of course, in terms of our data, we're looking over a 6-year period. We're also only looking at mothers with a younger child, and so therefore there are lots of other women and some men who have experienced domestic abuse that aren't covered by our study. So therefore, having nearly 14% of respondents saying that they've experienced some form of domestic violence and abuse is actually much higher than we would have been led to believe through previous surveys in the past in Scotland. Again, when we look at how many times since a child was born has any of these things happened to you, this was a question that was answered by those who said that they experienced abuse and violence. Majority, 40 or nearly the majority, 43.3%, were saying that they experienced one of those forms of harm on 1, 2, or 3 occasions. We also had 15% who were saying that it was too many to count. And interestingly, there was also 25% of respondents said that they don't know or couldn't remember or didn't want to answer that question. And we've done some further analysis on that subgroup to try and understand whether or not the characteristics of that group are similar or different to those who were able to recount how often these things had happened to them. Finally, when we looked at sort of what type of harm had been experienced by a current or previous partner, because by the time of the child's 6th birthday, some of the women were in a different relationship at that stage or no relationship at all. 10.6% reported experiencing coercive control, 7.2% reported experienced physical violence, 6.6% had experience of threats, and 13.6% of respondents were saying that they had experienced any of the above, with 3.5% saying that it was from their current partner. On this slide, I'm not going to ask you to sort of spend too much time looking at it, but it provides the data that I'll come on to talk about in the next slide, which is really getting to some of the points that Bridge and Kate were talking about earlier on, which was trying to think about, are some women not only in situations where they're experiencing violence and abuse, but also find that their space for action and their options for how they are able to exert some independence within that relationship, are they constrained by the circumstances in which they find themselves, either through the educational opportunities that they've had, their age and life experience, or because of sort of the material resources that they have available to them. What we found was that compared to mothers in the highest income households, mothers who were in greatest poverty were more likely to experience any form of abuse, and that they had 5 times a greater chance of experiencing more types of abuse more often, really drawing out the fact that actually, if you're living in poverty, your space for action and your ability to take action is much more constrained than if you have greater access to money and additional resources, which allows you to either think about leaving or allows you to access other forms of help in a difficult situation. We also find that mothers who were both in the youngest age category and the poorest income category were 3 times more likely to experience some form of abuse. And in contrast, those who were neither the youngest nor the poorest still had a chance of experiencing domestic violence and abuse, but it was 1/10 of the likelihood of that compared to those who were in the poorest and youngest age categories. And mothers on the lowest incomes had a 2-fold chance of experiencing low intensity abuse and a 5-fold chance of experiencing high intensity abuse. And what we're really saying there is that if you're coming from a situation where you're in poverty, actually not only are you more likely to experience abuse, you're also much more likely to experience the most severe forms of abuse and violence, and therefore it reinforces our need to engage with poverty as being both one of the factors which causes and sustains domestic violence and abuse, but also gives us some indication of what we might be able to do to try and address it. I'll come on to talk about that on the next slide. Finally, one of the key findings that we found puzzling and we're still trying to make sense of is that being the mother of a male study child was associated with a small but statistically significant higher chance of experiencing violence than being the mother of a female study child. That's not something that's come up in any other similar study internationally, so we're not sure if that's just a fluke, a random thing that's arisen in our survey, or whether there might be something there that we've detected that hasn't either been looked for in other studies or just hasn't become apparent about whether or not actually gender isn't only about the gender between the adults in the household, but there's also something about the gender of the children that introduces a dynamic that needs to be considered. So it's not that male children are the causes of domestic violence and abuse, but what is it about having a male child which may actually change some of the dynamics between a person who uses violence and abuse in their relationship and their partner, where they feel that actually they should be, they've got more permission or more scope or need to misuse power and control in these particular ways. So what's the implications of our findings? Firstly, we think one of the things that we need to be sort of discussing is not only about counting the frequency of incidents, but also to moving to a position whereby more surveys try to assess the impact on children and adult victims. And we think we've got some scope to be doing that in work that we're currently doing at present that we'll come back with at a future point in time. As I've highlighted, there's a strong link between financial insecurity, poverty, and experiences of repeated and more severe abuse. So what is it that we can do that tries to increase the space for action for women in relation to themselves and to their children? And are there ways that both employers and the state can try and think about trying to increase the financial resources available to victims of domestic violence and abuse? And I've seen some of the questions already. Public funds. One of the things we find, group the research, and one of the things that sort of one of our advisors was flagging up was that the Future Generation Commissioner for Wales actually provides a grant to employees who are experiencing domestic violence and abuse. I think it's about £500, so that if they need immediate financial assistance to do something as a result of what they're experiencing, that their employer is giving them a small cash grant that's not repayable, but also able to sort of advance them their salary as a way of trying to give them some economic means to try and navigate, to widen the range of options that they have available, and to be empowered and supported to make the decision that they think is in their best interests because they've got the financial resources to do it. We also think that there's a need to provide robust preventative education to young women and men about respectful and safe relationships, because age did seem to be an important factor here in terms of the age at which women became pregnant with their children and therefore the connections that they had with other people and other services. But that focusing purely on preventative education programs is unlikely to be helpful for those in greatest need, and therefore they have to be seen as part of a range of measures to tackle both the causes of gender-based violence and, again, trying to increase the space for adult victims to feel as though they've got as wide a range of options to choose from, so that they can be supported to choose the one that they feel is most suitable for them. And finally, looking at places where I'm based in Scotland, is trying to locate domestic abuse policies within a wider agenda, which is about creating equality between the genders in society, and that merely trying to deal with the symptoms of it actually won't stop us still dealing with these issues in 10, 20 and 50 years time from now. Finally, to finish off, conference has come along at a good time in that tomorrow myself and some colleagues are just publishing the Routledge International Handbook of Domestic Violence and Abuse. It's about 800 pages long. It's got contributions from over 100 authors in 20 countries, and the book's got a wealth of material about domestic violence in the broadest context, not just within intimate partner relationships. The book itself costs about £190 in the hardback version, but the ebook's about £30, so it's much more affordable, and it's exactly the same as the hardbook version. I think it does touch upon many of the issues that we're exploring today. So thank you very much for your time and for listening to the presentation.
We're moving on now to Sistah Space, Rose Lewis and Ivy MacCarthy to make that contribution. Really interested to hear about this extremely well-known organisation and its work, particularly because we've already been having discussions about people from different ethnicities and cultural backgrounds. So over to Rose and Ivy.
Hello.
Hi, good morning, everybody who has logged in. How you all doing?
Hello.
Nice to meet you. Thank you all at Kingston University for inviting us. Dermot, thank you. We've been talking and it's very nice to be here at last. And thank you to all the other speakers as well. We managed to hear a lot of what you were saying and we thank you for your contribution too. We are from Sistah Space. We are based in East London, Hackney to be precise, in East London. And we are a specialist domestic abuse service, specifically for African heritage women and girls. That's for, most of you may call us Black women who are from the Caribbean, Africa, Australia, don't matter where you are from. Women of also mixed heritage, you know, we deal with everyone from that. That's our speciality. We were founded due to the passing of Valerie Ford and her daughter, baby RJ, who were murdered by her partner in 2015. After going to the court case, our CEO, Ngozi Fulani, realized and recognized that there were no services for, no particular services for African heritage women and girls who had been through domestic abuse. So they're mainstream services, but nothing for us. And she decided, you know what, that's going to change. And she set up Sistah Space, and we've been is the word advocating, working for, making noise about, making sure that our voices are heard when it comes to domestic abuse and sexual abuse. So we, as a specialist service, one of the main things that we've always said is about, it's so important for us, African heritage women, to tell our story, to tell and get us included into the VAG sector, violence against women and girls sector, because for a very long time, everybody else has been speaking about us, for us, and a lot of the times our voices are not heard. We're not included in anything. We're not, you know, then nobody says, come and sit down and let you tell us about what is going on in the VAG sector. What's the word? Let us, you tell us about the experiences of women. You tell us about the experiences of grassroots women and girls and what they've been going through. We're constantly just reading up about us, and so we decided, you know what, we have a service here. Let us speak. Since we've been set up, we have been constantly in it with the women. Yeah, just bear with me a second. Our whole existence is based upon the women and the girls and what they tell us. They tell us what they need. They tell us about their experiences. They tell us about their experiences with mainstream domestic abuse services, the police, the justice system, social services, education, and everything. And we take it very seriously and bring that on board to, this is where we are now.
And it's very important because we absolutely and completely embrace intersectionality. And that, if you think about it, is exactly what we are founded on. because we are not talking for all. Since it's a specialist organization, we are able to cater for the exact needs that our women have. We also don't ascribe to BAME. And I know it's one of the controversial subjects, but we are Black women, and that is where it stops. And we offer our services to women who look just like us. We don't want to be spoken for. We don't want anyone telling our experiences. We don't want, in a way, to be spoon-fed about what we have gone through and what our experiences are like. We want to tell our stories, and we want the women to be able to express themselves and tell their stories and experiences just as they have happened. And so when it comes to the word BAME, we don't ascribe to BAME. We are Black women, we are African women, we are Caribbean women. No matter which part of the world you come from, we ascribe ourselves as strong Black women who are trying and who are fighting for other Black women who are not in the same positions as ourselves. We also provide specialist services, just like Rose said, where we make sure that we are not telling the women what they need or what they have to get at any point in time. We are making sure that we are asking what they need, what they want. We're finding out what we can help them with to get them along. We've got, obviously, women not reporting abuse, and that is a huge issue. Whatever the reasons are, be it they have had any form of discrimination from the police, from social services, from the hospitals, the list is endless in terms of the reasons why women don't report abuse. And we are realizing that there is a huge need for training, not only amongst ourselves, but with the mainstream organizations as well, in terms of how to deal with Black women, because there is a lack of understanding and there is a lack of services and support provided to women who look just like myself and Rose. And so Sistah Space makes it a point to make that our focal focus need to ensure that the women are properly taken care of. First of all, taking care of their needs, taking them to safety, and then being able to help them improve themselves going forward.
Some of the other issues that we have, which does stop women from reporting, are to us things that we've been going through our whole lives. A lot of stereotyping about Black women, and all of you should know that by now. We're aggressive, we're loud, we're confrontational. So we could just be asking you a question, and because we persist, it's seen as being loud or confrontational. We have enough evidence where, you know, we've taken a service user to a service, and the people at the desk, in high power, by the way, would actually stop you from wanting to report what you had to say and want you to conform to what they want you to, who they want you to be. So we got a lot of stereotypes. We got a lot of myths about Black women. Our relationship with the police in the African community generally is not very good. The history is there, the facts are there. The police and their views, the whole stereotypes and how they think about us has a huge impact on women going to report. We have immigration. What happens with us African heritage women and girls? So we go to report an abuse, but sometimes the abuse becomes secondary, because if there are issues about immigration, if there are issues with social services and things like that, women sometimes have to juggle and decide, which one am I going to do? If I report this, the immigration comes up, I will be reported to immigration. Even with women who have their stay, who have got their status, all that comes into play. We have the whole issues going on around with the Windrush generation. Nobody's thought about whether the Windrush generation and domestic abuse, it goes hand in hand, but yet still, with all what's going on with Windrush, they're set aside, and once again, domestic abuse doesn't come into play.
Also, just as Rose said, when you think about the stereotypes, and even one of the reasons why women wouldn't report abuse is because of sometimes how they are thinking of the police treating the perpetrators, even though they need protection from them. That fear of how the black man is going to be treated by the police alone puts so much fear into them, they wouldn't go and report. And you find so many instances where a woman would be so scared, also because of stigmatization of the community, wouldn't talk about anything because of the way her community might view her in reporting. She more or less becomes a snitch, and so that stops her from doing, or reporting or keeping herself safe, and she ends up staying in that relationship or in that situation for a much longer period than she needs to. What I would have to say is we've got such a massive support, not only from the community, but from other organizations as well, who recognize and understand what we are saying, who are giving us the chance and listening to us. They are hearing us, they are seeing us, and they are having a better idea of us saying we need to be able to tell our own stories. We need to be able to be frontline. There are so many policies that are put in place, including bills, that there isn't any consideration for the Black woman, and you don't find any of us at the table making these big decisions that have anything to do with us. Again, that comes down to other people talking for us, rather than us being able to talk for ourselves and say to, leaders or policymakers, this is exactly what you need, because we are in the same position as these women. We may not be going through the abuse, but we come from the same cloth, in a sense, and so we know what the needs are, and we need to be able to input our own thoughts and opinions and options for women to be able to get better services. When the bills are made, it still doesn't cater to us. That understanding is still not there. So we would like to say a big thank you, especially to our supporters, because we wouldn't be able to do any of this. Without them. It comes down to us being able to offer training. It comes down to us being better and being able to educate others as well in terms of what we are doing, how it needs to be done. And our story continues to go on, and more stories are added to it, because women are able to open up now and to really tell what their experiences are, and their shared experience between all of us.
And just a couple of very small examples about African heritage women and girls being included in certain things. So during COVID, for example, when food was being given out, and that was seen as a not speciality, is the word for it.
In terms of what they specific foods.
The foods that, for example, the foods, yeah. So food was being distributed. A lot of people will say, just be thankful for what you got. You're getting some food, be thankful for it. But we weren't considered in that food. We have our own foods. Which is very important for the welfare of people. So you were just given the food that just everybody else get, but that's not your taste, that's not your palate. If you're an elder, if you live by yourself, you're just given tin food all the time. There's a lot of us that don't do tin food. We don't do tin potatoes and tin carrot and things like that. Nobody thought about the kind of things that we need and that we ate, except for, once again, the grassroots community who were cooking food to give to people. The government and all them people give money to people, and people just went, and it's all tin food. Just, little things, but very, very important things. Little things, but very, very important big things. Like when you send women to a refuge and you take them out of their environment, out of London, and we understand that you know, that maybe there's nothing in London or anywhere close by, but you send them far away.
And their support.
Their support system. All women need their support system. But when you don't have your own food to eat, when you don't have your own products, where we have to cream our skin because we got a different skin type to you, where you can't get your hair products, because if you are going through domestic abuse and you're not able to cream your face, wash your hair with your own shampoo, it makes you feel low, and it makes you feel even bad. When you don't take into account about language, and oftentimes there are no interpreters. When you don't take into account maybe just little things, but big things, like they go to church. Church is very important to a lot of women. And there are churches that some people will not even go into, or they feel that they wouldn't be accepted into. So there's just so many examples that we can give you, but I just thought that, you know, we may have just mentioned things like that. One of the things as well, the media needs to, as we say it, they need to fix up. Yeah, they keep leaving us out of the conversation, and they keep choosing what they think is going to make big news. And unfortunately, they feel that African heritage women, Black women, do not make big news when it comes to domestic abuse and domestic violence. And do I have to tell you all about Blessing Olusegun, who died last year? No media coverage. Biba and Nicole Smallman, both of them were murdered again in the park. There was no outcry, there was no media coverage, and this goes on and on and on and on. And then when we start to say things, the first thing that these people come up and say is that we are always talking about race and racism. Yes, we are. Yeah, because it's a reality and it's a truth. And so we at Sistah Space, and there are lots of other people as well, we are adamant, and we will not stop talking about our experience, which we call her stories, our story. We will continue to talk about, and we hope that you get something out of it. And if you don't, you might not get it today, but another day that you might do.
Yeah, so we would like to definitely thank you for giving us the platform to be able to express ourselves and tell you a little bit more about who we are and what we do and how we've gotten to the point where we are at the moment. And again, like I said, the support is massive, because the need for Black women to be able to express themselves, talk about the abuse, get the help is massive, and it's bigger and wider than we can actually comprehend at the moment. So we would like to say a very big thank you for allowing us to talk, and yes, letting everybody know what it is that Sistah Space does. Thank you.
Well, Rose and Ivy, thank you for really expressing some important feelings and ideas from yourselves and your experience. That's really important for people to hear, and I hope there'll be some way in which people can gain more understanding of your perspective and your experiences by making contact with your organisation and with the information that you've provided with us. Thank you very much for that, and I do hope you'll stay for the questions, because I think people are going to be wanting to ask you things.
Yeah. Thank you.
And can I now move you on to Anna Mitchell, who's our next speaker, to make her contribution. Anna.
Thank you so much, everybody. I've really been enjoying listening to everything, and particularly the last speakers. And you know, it's one of these times where you're like, I quite like to listen, but now I've got to actually speak. Hi, everybody. My name's Anna Mitchell. I'm in lovely sunny Scotland at the moment. I am the Safe and Together Institute UK lead. And my background has been working in domestic abuse, primarily in Edinburgh and Scotland. I had my last day with Edinburgh Council 2 days after lockdown in March, and began working full-time for Safe and Together. And you know, when I reflect back on so much of the discussions we've had already, when I reflect back on the work that I've done with all different services and agencies, I begin to sort of really reflect on how important systems change is, how important a shared approach is and a shared language. We've talked so much already today about how different systems work and how they impact on different groups. And certainly having a shared approach and a shared way of viewing the issue around how we work with domestic abuse is really significant. So I'm going to talk a bit about practice. I'm going to talk a bit about what some of the things we've heard today mean for how we work with families, right down to practice around questions we ask, how we document, how we case plan with families, how we make assessments of the impact of domestic abuse on children. So I do want us to think about how some of the things we've talked about so far land in our day-to-day work. Just to introduce the Safe and Together Institute, their mission is to create, nurture and sustain a global network of domestic violence informed child welfare professionals, communities and systems. So there's something here about domestic violence informed and what that is, which we'll talk about. There's also something about the need for change to not just lie with professionals in their practice, but in wider communities and in wider systems, and that there's a need for that change to be initiated, but then how do we embed it? How do we make sure that it is nurtured and sustained in the longer term? So Safe and Together as a model has been developed in the States. It was developed in North America, and when I was in Edinburgh, I introduced it to Edinburgh, which was the first time that the core training was delivered outside of the States. And really since then it's spread to over half of the local authorities in Scotland. It's in various parts of England now as well, Manchester, Sunderland, and in Barking and Dagenham, in Waltham Forest and Hackney. We also have an implementation lead in Waltham Forest and Hackney based in Respect. So it's something that has spread across the UK in quite a spontaneous way, because it does really tackle some of the shared problems there are around domestic abuse and child protection. So it's about the intersection of domestic abuse and child welfare that this model focuses on, and that really complicated issue of how we try and keep everybody safe. And we talked about some of the sort of intricacies of that already today. It's in large parts of Australia. It's been quite supported by Aboriginal communities in Australia. It works well with historically marginalised and oppressed communities, and I'll talk a bit about why we think that is. I'm going to spend some time just really talking through the Safe and Together principles, and I'm going to do that in a way that is describing some of the problems that there might be now around how we practice. And some of these criticisms are systemic and some of them are long-standing, and they've been around for many, many years in literature and research, and they're also global. So a lot of these issues are shared across Australia, across UK, across America. I'd also like to say that some of the issues are well-intentioned, that they come from a place where people are worrying about the safety of survivors and children, and sometimes the way of dealing with that results in outcomes that aren't as positive, but they come from a place where practitioners are worried, and sometimes we need to think about how we create a different way of meeting those needs to keep people safe and for practitioners to do their jobs. So the first principle of Safe and Together is to keep the child safe and together with the non-offending parent. So we see that as providing the best outcomes for the child around safety, healing from trauma and stability and nurturance. And those are outcomes that we think people can work towards whatever service they're in, whatever family member they're working with. So even if you're working with a perpetrator, to be thinking, how do the parents separately create safety healing from trauma, and stability and nurturance, or how do they undermine those positive outcomes for children? So it's really child-centred. It's asking us to always think about what we're doing that helps create those outcomes, but it's also got an underlying assumption that our greatest ally around child safety is the domestic abuse survivor. That actually they are the people who are going to have the most information around the risks to the children, around the perpetrator's pattern, and that they will be doing lots and lots of things to try and keep their children safe on a day-to-day basis. So that's really trying to think about a child-centred way of creating positive outcomes for children and families. So the second principle of Safe and Together is to partner with the non-offending parent as a default position. And that really comes from this idea that we want to try and keep kids safe and together with the non-offending parents. So, and partnering is a massive, massive part of that. One of the key drivers for Safe and Together in Edinburgh was a case file audit that we undertook, where we looked at the practice around domestic abuse cases in children and family social work. And what we found was that there wasn't really a clear understanding of the perpetrator's pattern of coercive control. There was information about police call-outs or singular incidents of physical violence. There wasn't really a clear articulation of the wide-ranging ways that coercive control impacts on children, and that case plans tended to be a one-size-fits-all. You know, she usually focused on mothers, that they need to move home, they need to separate, they need to phone the police. So these were a sort of thing that we came with to families that we were working with that would help us feel that they were protecting their kids. So it was a sort of one-size-fits-all, this is what it is to be a protective parent. And really in that was a real lack of understanding of, firstly, the hugely disruptive impact that some of those actions have on families and children's well-being. And also they fail to recognise all of the other things that survivors were doing on a day-to-day basis to protect their kids. And I don't need to reiterate, you know, I wrote down some of the things that the previous speakers in Sistah Space spoke about around the challenges of doing things like phoning the police, immigration status, experience of racism and discrimination, how are the police going to treat their partner, how are the community going to react. So we can't come in with a really sort of one box of how you are a protective parent. We have to widen out and acknowledge all of the things that survivors are doing on a day-to-day basis to create these outcomes that are in Principle 1, safety, healing from trauma, and stability and nurturance. And along with this comes an idea that we have really quite high expectations of mothers in society, that we see them as being the people who are the primary caretakers of children. We see them as being responsible for the impact of and outcomes for their children. And what that brings with it is a lot of gender double standards of parenting, where we have high expectations of mothers and quite low expectations of fathers. And what that results in is survivors feeling blamed when they come in touch with services, and further to that, that they may then fail to engage with us, and we then cannot reach a goal of child safety. We aren't going to be able to understand, make assessments, know what's going on in a family if we do not partner as a default position. So there's something here about partnering being good child welfare and child protection practice. The third part of this is a principle around intervening with the perpetrator to reduce the risk and harm to the child. So we've got quite a broad understanding of what we mean by perpetrator accountability and engagement. We aren't just talking about criminal justice responses, which we know impact heavily on Black men, on poor men, that actually we need to think widely about the different ways that we hold a domestic abuse perpetrator accountable in our communities, in our families, in our systems, and that we don't just hold them accountable as a domestic abuse perpetrator, but we begin to engage with them about their responsibilities around caretaking for their children, around their role as a father, about how the role of fathers impacts on families, and we begin to talk in a much more comprehensive way with them about how their particular behaviours impact on their kids. So this is more than just police engagement. It's really thinking widely, and part of the way that we really hold perpetrators to account in the Safe and Together model is by having a perpetrator pattern-based approach. So it's not just about direct engagement with perpetrators, it's about making sure that whenever we speak about domestic abuse, whenever we're in our meetings or we're writing reports or we're speaking to each other or we're speaking to survivors, that we really hold the perpetrator as being responsible for the domestic abuse, for their parenting choices. So domestic abuse perpetration as a parenting choice, and that we begin to talk much more about behaviours and be specific and articulate about how they impact on the child and family functioning. So another good skill for workers is being able to describe the perpetrator's pattern in the current relationship, in the previous relationship, and be able to articulate the wide-ranging way that that impacts on child and family functioning. How we do this is through various different tools, training and resources. What I've described are the three principles that underlie Safe and Together as a model. There's also a series of critical components and model characteristics. And what we want them to do is land in people's everyday practice, whatever their role is in working with the family. So we want this to be something that results in asking different questions, in different documentation, in case plans that are behaviourally focused on the perpetrator rather than the survivor, that actually this begins to be the how of some of the things that we've talked about today. And it's an approach and it's an intervention for practitioners. It isn't an external service. It isn't something that you refer families to. It's about how we speak to each other, about how we view the issue of domestic abuse when we're working with families, and goes right through from, you know, how court reporters might write reports in family court processes, to children and families assessments, to people who are working with substance use and mental health about how their work with perpetrators or survivors creates better outcomes for kids. So it's really creating that shared language and cross-system collaboration to try and create better competency and working together. And really, with the end result being better assessments, partnerships and case plans. And where Safe and Together has been implemented and evaluated in parts of the states, there's been a 50% reduction in children accommodated due to domestic abuse. And because there's a nuanced assessment of what needs to happen for children to remain in family homes when they're feeling that it's safe and that there's enough protection for those really critical decisions. And it provides practitioners with a really clear decision-making process around these difficult parts of our work, and defensible decision-making that can be shared across all the different systems and agencies that are involved with the family. So we have core training, supervisors training, training certification. We've got there's certified trainers in London, but we also provide webinars and resources that we just send out usually on our mailing list. So I'm going to ask if there can be links put into the chat so that you guys can stay in touch with us, because we've got webinars and resources that we just really want to share that can help support people in their practice. I'm going to take time now just to read out a case example that I think really solidifies some of the changes that Safe and Together helped bring about, and it helps you see the practice shift. It was a case note that was written by one of our certified trainers in Edinburgh, Andrea Davidson. She's a senior in a children and families team, and she became a Safe and Together certified trainer. And after she went to the core training, she came back and rewrote part of her case notes and reports. And I'm just going to share that with you because I think it really highlights some of the shifts. So this is what the case note originally said. On 24th of February 2017, David assaulted Margaret. David was arrested, charged and remanded in custody. So you can see that is focused on arrest, it's focused on custody, it's focused on assault. It doesn't tell us anything about the child. It doesn't tell us anything about the impact on the child. It doesn't tell us the things that we need to know if we're in like screening and intake or assessment, or we've been allocated a case. And this is how Andrea rewrote this case note, and in red are the critical components of the Safe and Together model, so I'll highlight them as I go through. On 24th of February 2017, David assaulted Margaret by punching her on the face, causing 2 black eyes and a swollen jaw, so that's the perpetrator's pattern being much more described there. Margaret called the police, so put in a protective effort, and David was detained, charged and remanded in custody. David has 3 convictions of domestic abuse against 2 previous partners, so they're putting in the pattern from other relationships and not just assuming that because that relationship's ended, the behaviour's changed. So it's a perpetrator focus. Margaret said they began arguing because David was unhappy that she'd allowed Connor, who's 13, to go to the shops on his own in the dark. Margaret also said she'd sent Connor to the shops because David had come home drunk and she wanted Connor out of the way in case David kicked off. So that's a protective effort that could have been looked at as a poor parenting choice if it wasn't put into the context of the perpetrator's pattern of coercive control. Becomes a protective effort when looked at in context. Connor was kept awake due to the police being in attendance at his house. He'd slept in for school the next day and was late. He was already on a behaviour card, got in trouble from his guidance teacher who had not yet been made aware of the police incident. So looking at the impact on the child, wider than trauma impact, wider on did they see it, did they hear it, were they in the same room, and starting to articulate the disruption to education settings that could be related to family, friends, a whole bunch of different impacts from that behaviour. The incident happened 2 days before Connor's 13th birthday. Because Margaret had visible injuries to her face, Connor asked that she cancel his birthday trip to bowling as he was too embarrassed to let his friends see his mum's face. So again, the impact on the child. Because Margaret had called the police on David, David's family fell out with Margaret. Connor was therefore unable to see his paternal grandparents, aunts, uncles and cousins around the time of his birthday, nor did he receive presents from them. Connor was made to visit his dad in prison on the day of his birthday. So that's the impact. As David controlled the family finances, Margaret did not have full access to money whilst David was on remand, so that's the perpetrator's pattern. Margaret was unable to purchase Connor the computer game he wanted for his birthday. Connor said he had the worst birthday ever and that he was angry with his mum for calling the police. So I really hope that you can start to see how an articulation of the perpetrator's pattern in that way makes a difference to how we might view a case, to how we might assess a case. I want you to think about how it would look if we had reports or case notes written in a perpetrator pattern based way. What decisions would be different in screening and intake? How would people work differently with the family? How would family courts view situations differently if they were perpetrator pattern based? And really importantly, how would all members of the family, if they read some of those reports, feel? Would the mother feel like the reality of the impact on the child was, and her protective efforts was really understood? Would the child see their lived experience in some of those writings? And would the father understand why his behaviour impacted on the child and what it is that we'd like him to do differently? So I wanted to just land some of that in practice. I've got no time left, so I'm going to move on, and I'm hoping that some of those links can get put in, but please do get in touch if you want to find out more about Safe and Together and how it's been implemented in the UK. Thank you.
Well, Anna, thank you very much for that wonderful contribution. And what it does say very clearly to us is we can act and intervene and be involved in this way in these situations in ways which can be more helpful to not only the person who is subjected to domestic abuse, but also to other members of the family and the perpetrator. And we've been saying throughout today that the child also. We've got to the plenary discussion, and thank you all for keeping to time. So we've got a reasonable amount of time to raise issues and discussion any further. Rick, do you have comments from the stream to talk to us about.
Yes, thanks, Malcolm, and thank you very much to all the speakers. Hugely thought-provoking, and again, you can see that stimulating debate and comment in the Q&A. As you'd rightly expect, a lot of acknowledgement and praise for the work done by Rose and Ivy and colleagues at Sistah Space, as well as a few questions, I suppose. One of which is about one of the things that you were talking about was the extent to which the cultural issues, including the effects of living in a society where there's lots of structural discrimination and exclusion, actually inhibits and prevents women from speaking out and seeking help in relation to domestic abuse and violence, and how you can address that.
So we take into consideration, and we're very aware of the fact that, you know, these issues are there. Now, because we work based on the needs of the woman, we need to, like I said, we take intersectionality into consideration. So it's not one, you know, dress fits every woman that comes in. Support is tailored according to the needs of the woman. But again, education plays a big role, where we have to, it's almost like a brainwash in terms of how they feel, stigmatization of the community, and how they've been treated by other mainstream organizations, be it when they need support or even if they're reporting. We make sure that we make it very clear in terms of how we can help them and the steps that needs to be taken. And support is continued up until the time that the woman herself is ready to make that step. It's not always straightforward in terms of how that is going to happen. Sometimes it takes longer than we expect it to, depending on what the abuse is. But our number one priority is safeguarding. Our number one priority is making sure that if a woman discloses or reports any form of abuse, we have to be able to get her away from that situation and then work on how she would be able to either face reporting it or, you know, dealing with her community. And that again comes to us being able to talk to them, supporting as much as we can all the way, and taking it from there when they're ready, properly ready, because again, it's tailored and based on what she's able to take at whatever point in time. And so those are the steps that we take. But again, because there are different women who come to us, everyone's needs are different. So we deal with everyone differently. We haven't got a specific criteria or policy in terms of how we do that. We go according to the needs of the woman.
Thank you. And I think possibly that has a bearing on some of the, another of the points that came up, or a theme in the comments in your presentation, was that it probably provoked a lot of thought, particularly for people working in other agencies, other organisations, in terms of, well, how can we do better in terms of serving the needs of the different communities with whom we work. It would be too general a question to ask for, how can organisations do it better? But perhaps it might be also to ask, well, is that the sort of thing Sistah Space does as well? Do you provide advice and consultancy? Can organisations contact you to ask about supporting Black women, for example, in that area?
Yes, so the first question, which is really important, how can mainstream and other organisations do better? First and foremost, because a lot of people don't know that Sistah Space exists. So most people would say to them, go to Women's Aid, or go to this domestic abuse person, go to the people in your own community. So how can people do better? How can mainstream do better? Let's just very quickly just look at how can mainstream do better. Mainstream needs to do better to have, for example, workers that speak different languages. There are often a lot of workers and support people who speak 3, 4, 5 languages. Try and find out what languages your workers and your professionals speak, so that no woman is left out because she phones and she has to go through and speak to 20,000 people before somebody could even know what she is asking. And as well, even what you're asking, there are key words. Language is just so important in this whole thing. How can organizations do better? They can do better by speaking to us and other grassroots organizations to know the services that we provide, that our name is there, that, and we have to do the same thing as well. We're not just honing on them. We have to do the same thing as well. How can organizations do better? Come and see what's happening in the grassroots community. Don't just look at everything, and even some of the counselling and the therapies that you provide, you're just looking in a book. This is the way that we do it. This is how it is. This is how it should be. Those kind of things are very important in terms of doing that. I can't even remember the second thing that you just said, so you just may have to repeat that. Yeah.
Never ask two questions in one. I think that's it. Can people ring you to ask for advice? I think was the other thing. Yeah.
They definitely can ask advice. We are not closed off because we're grassroots organizations and not being able to help, because there are other organizations that signpost women to us. And so before that is done, obviously there's a conversation between ourselves and other organizations as to how best to help the person they are signposting to us. But I think the main important thing is organizations or mainstream organizations need to look at their structural framework and how they view a woman as an individual and as a person, rather than looking at the procedure or the policies that they have as an organization dealing with women in that regard. But in terms of coming to us for advice or us being able to help, we are open to that, because we understand that there are a lot of African and Caribbean women or Black women who have, are with other organizations where they are not getting the help that they need. So we can't be closed off with what we know about our women and say, it's just Sistah Space, and unless you're with Sistah Space, then you wouldn't get the help. We're more than open to be able to give the advice if needed. And if there's any signposting, we're more than open to welcome any woman who needs specialist help.
Thank you very much. Just looking through the Q&A, and I think we could pepper you with questions, Rose and Ivy, but that might be unfair. Following on from Anna's presentation, and this links, I suppose, to what you've been talking about just now, is, well, what kind of systems change, broader systems change is necessary so that mainstream services become more attentive to the individual needs of the people that they work with?
I think the thing is having shared principles of where you're trying to get to help. So if you have the safe, and so in Scottish Government, for example, they've said that they support the principles of Safe and Together. So keeping kids safe and together with a non-offending parent, partnering with survivors, holding perpetrators accountable. These are things that, when you apply them to systems, create quite clear improvements. So they can apply to people's individual practice, but they can also apply to, for example, in Edinburgh, we worked out that our system didn't allow us, when we rehomed a survivor, to not make sure that the perpetrator didn't move next door. That's a computer system issue that you can change, so it's more perpetrator pattern focused. But those kind of differences can go right through to bigger systems, like how do you make sure that our family court processes partner with survivors? How do the police and their response help us partner with survivors? How can we think about the way that our substance use and mental health systems allow for the fact that sometimes survivors' substance use and mental health is a direct result of the perpetrator's pattern of coercive control, or they might be interfering with their ability to access services. So having sort of clear principles of what good domestic abuse informed systems and practice looks like helps us create improvements that can be really quite wide ranging. And certainly I'd highlight the self-assessment and evaluation toolkit that we've got, which allows you to think about how practice is domestic abuse informed, but it's also got a section on domestic abuse informed leadership, and you can grade your system, your organisation, on how they embed change. You know, are these domestic abuse informed principles in policy, practice, performance frameworks? Half the time we can't even evidence when things are going well because we don't collect the outcomes that we need to be able to show things have got better. So what indicators are needed for us to collect to get better systems and better improvements? So there's lots in that evaluation toolkit, but there is something about it being a top-down and a bottom-up process. The thing that I think is really powerful about that case note, though, is that case note creates change in lots of different systems. That creates a different assessment, it creates different information and thresholds, it creates different allocations, it creates different decision makings from courts or other processes. So you have got the opportunity as a practitioner to create bigger systems change just in how you document and write and work with families, but there does need to be a top-down process too.
Thanks, Anna. And I think part of that then, because you mentioned evidence, didn't you? The evidence that feeds into changes to policy and practice, and help agencies and practitioners do the best work they can. And a question early on, I think aimed at John, was to what extent are or should survivors of domestic abuse and violence involved in producing research, shaping research, and shaping the way it's disseminated and understood. And whether that was something that was, maybe part of your study as well, John.
That's a very good question, Rick. And we've been working with the 4 main women's aid federations across the UK to come up with guidelines and principles about undertaking ethical research around domestic violence and abuse. And one of the key principles is that it's got to be alert to and built upon the experiences of those who we want the research to benefit most, those who have experiences as adults and children of victimisation. And how we do that needs to be carefully managed so that it's not exploitative, but is meaningful at the same time, and it deals with some of the issues that we've talked about this morning about recognising that those who are victims of domestic violence and abuse are diverse, both in terms of their characteristics, in terms of their experiences, and in terms of their needs. So I think there's an increasing recognition that needs to be at the heart of both ethical and also high quality research, is making sure that we build that in from the beginning, as opposed to just saying something that it's really about just bringing people along at the end when we're sharing our findings.
Thanks, John. I wonder whether Anna, Rose, Ivy, did you have any views on the extent to which people, especially on the grassroots level, should or could be further involved in research and creating evidence that policymakers would take note of?
I'll just pop in and say that I think it's important that we hear all the voices. I think often we can hear survivors' voices when they access domestic abuse specialist services, and we really need to think about survivors who never access those services and hearing their voices too, because people who are involved in child protection or housing or criminal justice processes may not ever access specialist services. So I think there's something about the importance of us accessing a range of voices, I suppose.
Thanks. Well, I can see going through the comments, there's quite a few questions there that maybe even some of the presenters could answer if they get the chance. But we at this point, I think, have come to the end of the allocated time for the Q&A. I think. Is that right, Malcolm? And I'm handing over back to you.
Yes, thank you, Rick. I mean, I just wanted to say that there are so many ways in which we need to present people's voices, both through research. And one of the things you've beautifully done by asking these questions now is for you and John to draw attention to the fact that this is also a research conference for practitioners. It's about disseminating research, but it's also about engaging research in our thinking about practice. And that's one of the wonderful things about this conference. Every time I come to it, I think, well, this is a wonderful chance to think about how research can inform what we do to practice. But before I move on to the closing the plenary, I just want to say thank you again very much to Anna, to Ivy, and to Rose, and to John for the contributions they've made. They're really very stimulating and thoughtful and succinct and clear. Thank you very much. What I'm going to do in this session is twofold. Firstly, I'm just going to make very few comments to bring together some of the points that have been made in the conference. That will take me 2 or 3 minutes, but then I'm going to ask Rick to introduce us to the workshops this afternoon, which, if you've looked at the list, they're all fascinating, and I think lots of people are going to want to go to all of them. But if you just explain to us later on, Rick, what's involved in those. But I just want to draw together a few points which occur to me from the whole morning that we've had together. And the first general point that I want to make is the one that we shouldn't lose, and that's the importance of the social context of poverty and not listening adequately to the situations that people face in living their lives in our very unequal society. And this is something that we have to think about doing, because although you think to yourself, well, social work is about doing things with people and in families, and of course it is, you can't neglect the fact that we've been shown again and again this morning how the poverty and exclusion, to use perhaps what's now an old-fashioned word, that occurs in people and their families, means that it leads more to domestic violence and abuse than it should do. So I do want to make that contextual point first of all, because the second point I want to make is that we've been told again and again that it's about listening to the voice of the people who are involved, and listening again to all the people who are involved and their relationships, and trying to work with all of those relationships and contacts. People have talked about intersectionality. What that means is that so many different factors are engaged in so many different ways with every situation that we deal with. And you've explained to us throughout this morning's session how this means differentiating between the different situations and how you can help in them. And people have talked in different ways about how you can do that. So that's really important, the importance of communication, involvement and responding. But I finally come to the point which several people have made, that it's the impact on children that we need to consider for the future of the lives of the people that we're working with. So not only do we have to help people live more successfully in their relationships, but we have to do this work in order to ensure the future for our children. And that's something that's really important to try to do. Thank you all very much for your involvement. Thank you all for your listening.